Hi, I am presenting scenario 2, and my official diagnosis is that Asia has cyclothymic disorder. For diagnostic criteria, she has symptoms that could match up to hypomania episodes and major depression episodes for bipolar 1 or 2, but her symptoms do not meet the full criteria for either of those. That is the first inclination that this is cyclothymic disorder for me. She has some hypomania symptoms like being hypersexual, days without sleeping, racing thoughts, and impulsive decisions. She also has experiences depressive symptoms like feeling listless, apathetic, withdrawn, and thinks of death. She has experienced this for at least 2 years with no more than 2 months at a time between mood shifts. And these symptoms are also not due to illicit substance use, medical conditions, or a history of psychological diagnoses. For diagnostic features, the essential feature of cyclothymic disorder is a chronic, fluctuating mood disturbance involving numerous periods of hypomania symptoms and periods of depressive symptoms that are distinct from each other. The hypomania symptoms and depressive symptoms are of insufficient number, severity, persuasiveness, or duration to meet full criteria for a hypomanic episode or a major depressive episode. During the initial 2-year period, which has to be 1 year for children or adolescents, the symptoms must be persistent and any symptom-free intervals last no longer than 2 months. And the mood disturbance must also not be attributable to the psychological effects of a substance or another medical condition. For development and course, cyclothymic disorder usually begins in adolescence or early adult life and is sometimes considered to reflect a temperamental predisposition to other disorders in this chapter. There is a 15 to 50% risk that an individual with cyclothymic disorder will subsequently develop bipolar 1 disorder or bipolar 2 disorder. Among children with cyclothymic disorder, the mean age at onset of symptoms is 6.5 years of age. For differentials, borderline personality disorder is associated with marked shifts in mood that may suggest cyclothymic disorder. If the criteria is met for both disorders, both borderline personality disorder and cyclothymic disorder may be diagnosed. For comorbidity, substance-related disorders and sleep disorders may be present in individuals with cyclothymic disorder. Most children with cyclothymic disorder treated in outpatient psychiatric settings have comorbid mental conditions. For treatment, a treatment option is cognitive behavioral therapy. It improves emotions by changing both cognitions, thoughts, and behaviors, and it enhances mood. I did use the DSM-5 to help me with this diagnosis for my source.